The Assembly is meeting this afternoon to discuss a number of bills.
One of those bills would make it easier to get contraceptives. Lance Vieser explains what's in the bill and who supports it.
Well, the bill would allow pharmacists to prescribe and dispense oral contraceptives and contraceptive patches. Under current law, women need a prescription from a doctor or nurse practitioner. The Republican authors of the bill believe that easing access to birth control will reduce unplanned pregnancies. The bill is opposed by anti-abortion groups. However, it does have bipartisan support in the Assembly. In fact, the measure passed the Assembly last session but died in the Senate. To become law, it would have to pass both the Assembly and Senate and be signed by the governor. Meanwhile, this morning, a group of Democratic lawmakers introduced the Right to Contraception Act. The bill would establish a right to access to contraceptives and a health care provider's right to provide contraceptives and information about contraception.
The devastating impact of the Dobbs decision, an assault on our freedom, highlights the need to do more to protect access to contraception. 90% of Americans support the availability of all types of birth control. Yet, politicians in states, including Wisconsin, have limited or proposed limiting access to contraception.
Well, that Democratic bill is in the early stages of just gathering some co-sponsors. As for the bipartisan bill in the Assembly today, it remains to be seen if it will gain any support in the Republican-controlled Senate.